Well, folks, back to work we go. Not that I had much of a vacation, considering everything that happened, but that's life. Everything sucks. And then you die. And believe me, I've been looking forward to that a lot. If you're not familiar with me already, I am a therapist. So 3 days out of the week, I am seeing clients. By the way, I have red dye on my hands because yesterday there was a situation that led to red dye being on my hands. And that's where we can leave it. So I don't want to hear a bunch of cutesy remarks about the red dye that's on my hands. Monday, Wednesday, Friday, I'm a therapist. Tuesday, Thursday, I teach psychology at community college in Santa Clarita. I have to be able to do both things because that's the only way you can afford a shithole apartment in Los Angeles. But I don't really mind because I think if I had to do one or the other, I'd probably get pretty sick of it. So it's nice to be able to switch back and forth. Also, for legal reasons, I have to say that I am not technically a real therapist. Therapist is a protected title in California, which means that in order to call yourself one, you have to have certain qualifications and a license and all of these things, which I used to have. If you followed me on TikTok last year, you might remember that there was a viral incident that led to those qualifications being taken away from me. Now, I still have all the education and all of the training and all the crap, but it's just not considered current. So I can't call myself a therapist. I have to call myself a psychotherapist because the only qualifications you need to be a psychotherapist is you have to say, I'm a psychotherapist. So that's what I am. But I'm going to keep saying therapy and therapist because people understand what I mean. It's just an expression. God, what was I talking about? Okay, so I wanted to kind of make this video today because I wanted to talk a little bit about what it's like when I see a new patient so that anybody watching this can sort of get an idea of what to expect on their first day of therapy. I work in private practice, which means that I'm not a part of one of these big, sometimes you see something that's like New Horizons Health Clinic or whatever, and I am just me. So I'm Dan Henschel, LCSWC. I share an office building with other private practice therapists, but that's just in a roommate capacity. So what that means is I don't have a secretary, I don't have a staff, so when you call the number, it goes to my phone, and you just leave me a voicemail on my phone. So it takes me a long time to get through all those voicemails because I'm very busy. And people get pissy with me all the time because a lot of times what happens is people will decide to go to therapy because they had one breakdown or something happened in their life and they are like, well, I'll go to therapy and it'll fix all my problems and then I can get on with it. And that's not the way it works. Therapy, I usually liken to brushing your teeth. If you have oral cancer, brushing your teeth isn't going to fix anything. But that doesn't mean you shouldn't brush your teeth. It just means that it's part of an overall regimen of hygiene. So the only way it works is if you keep up with it over a sustained amount of time. A therapist is different from a psychiatrist. We cannot prescribe medication, nor can we diagnose mental illnesses. If you want that, go to a psychiatrist. What a psychiatrist won't do is care about your problems. A psychiatrist is basically a drug dealer. So you give them money and then they give you pills. A session with a psychiatrist might be 20 minutes long. Typically, when you see a therapist, you see them for an hour at least. And we talk about everything that's going on in your life. We talk about your stupid ex. We talk about whoever's not texting you back, blah, 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 blah. Whatever you consider to be a problem in your life. So that being said, the first step, if you want to see a therapist, is call me on the phone, leave me a voicemail. I'll call you back and I will ask you some preliminary questions. So, are you already diagnosed with any mental illnesses? What is your problem? And if somebody tells me, I have schizophrenia and I've been in jail 5 times, I'm probably going to say, you know what? I'm good. Have a nice day. Because therapy is really not supposed to be, like I said, for huge problems. So I'll ask you the preliminary questions. Depending on your answer, we'll schedule you your first appointment. You'll come in, and then I will begin to ask you further questions. And these questions are designed to sort of figure out what's going on with you. I'll give you kind of a preliminary diagnosis, unofficial diagnosis in my head. And we'll get to the bottom of whatever you consider a problem in your life. Like I said, therapy doesn't work right away. People get pissy with me about this too. They go to one session and they expect it to fix their whole life. That's not what happens. So what we work on in therapy is basically, we try to figure out what in your past is causing the problems that are happening to you in the present. And then the big thing that you might have heard about in therapy is inner child work. So we talk about, whatever your mommy and daddy didn't give you when you were a kid is what you are trying to get now as an adult. And that's what's causing all of your dysfunctions and your, unhealthy coping mechanisms. In theory, that's the best we can do. Remember, therapy is very new. The entire field of psychology is not really respected as a science because it's not science. We don't really know what we're talking about at all. When you get prescribed a medication, they don't know why it works. They just give it to you and they see what happens. And then they use that information for the next person they give it to. If you've ever been to a psychiatrist, they'll probably try to give you a medication that they just heard about 5 days ago because they want to see what happens. That's not to say the medication doesn't work for some people. It's just to say, don't consider your diagnosis to be the end-all, be-all of who you are. Because whatever mental illness you get diagnosed with probably doesn't even really exist. Honestly. I mean, that's the truth. And I can say that because I don't have anything on the line for me. I work for myself. I don't really care. People come to see me because I'm honest, because they saw me on TikTok and they want an actual therapist who can really help them with their problems and not some frou-frou idiot who's just going by the book. Mental illnesses are made up because we have to have some way to convince the insurance companies that we're actually doing legitimate medical science. So we have to say they have this disease, and then that way they can be treated using this. If we didn't do that, then the insurance would not cover it because they wouldn't consider it an actual profession, an actual medical problem. So we have to invent medical problems that you have. In 100 years, we might realize ADHD was never even a thing. Even 30 years ago, we thought it was a completely different thing. It only came out in the 80s. Before that, you were just weird and an annoying kid. So now, that is exciting in many ways because it means that there's so much potential for the future of mental health. But it's also a downside because it means that we don't really know what we're doing and nothing actually does anything. Again, that's not to say you shouldn't go to therapy. It's just knowing this kind of stuff about the process, I think, will ultimately help you get more out of the experience. Remember, therapy is all about you. So you are really doing the work. I'm just kind of like a trip sitter. So as you journey within yourself, I sort of tell you where to go and I help you process things. But you're doing the work. You're the one who's solving your problems, quote unquote. And a lot of times what will happen in therapy is that a year or 2 years will go by and you'll all of a sudden realize, wow, it did work. My life is a little better. Even though, maybe you didn't feel like it. So I guess that's really all you need to know about going to therapy for the first time. Beyond that, I mean, when you're actually in the session, the worst thing you can do is, be a big pussy, basically, and not tell me anything that's actually going on in your life because you want to impress me or you're scared of what I'm going to think of you. You're paying me. So you should not give a shit what I think. I'm going to tell it to you like it is. That doesn't mean that I'm going to make you feel like crap. It just means that I'm going to be the only person in your life who actually listens to your problems without the transactional nature of a typical relationship. And I mean an emotionally transactional nature, not a literal transactional nature because you're giving me money, obviously. I don't know. I guess that's it. Oh, God. Oh, I don't want to do this. I always try to schedule my most difficult people at the beginning of the day, and new patients, because new patients are just as difficult as old patients who are difficult. So because in the beginning of the day usually is when I have the most energy. Not today, because I've had the worst week of my life, but typically that's what would be the case. And then I have lunch, and then in the afternoon I schedule all the people who don't have any problems. The rich college students who all they talk about all day is their ex who won't text them back and whatever. I don't know. I guess that's it. I don't know. If there's anything else you would like me to cover as a therapist on this channel, let me know, because I would like to do some more videos about therapy. I think that can be really helpful for people and sort of help destigmatize mental illness and whatever. So let me know. And I hope you have a wonderful day.